is the 3-lumen central line insertion kit that's kept in the anesthesia workroom. It does come with already a sterile gown, so at this point you're going to have to do hand hygiene. You're going to open your pack without contaminating it. You're going to open a second set of gown and glove because you have your anesthesiologist you have to consider. All right? You're going to gown and glove sterilely. So I'm going to pretend I did that. I'm going to open up the other pack. Prior to this, I guess I should start at the beginning, is make sure you have an ultrasound machine. Ultrasound and the patient's prepped in order to actually scrub in. Now, I will tell you the majority of the anesthesiologists will want your assistance, okay, for the circulators. And then if, some of the scrubs are very familiar too, so they can jump in. This pack comes with the patient body drape. It comes with the saline flushes. It comes with local, but at that point probably you won't need it. I'm gowned and gloved. Patient's prepped. We can open our saline syringes. You can drape the patient. Just follow. It says head. And it has a nice little fenestration there to work through. So each of the kit does contain the catheter, the dilator, syringes to access the vessel, and dressing and a securement. So prior to actually cutting through the patient, you can toss this lidocaine off the field. You can save it for later. When we prep the catheter, we're going to use our syringe to flush the lumens. If the anesthesiologist is a cardiac anesthesiologist, you'll want these microclaves open, okay? Some of them will be okay with deadheads, but I would probably encourage the microclave, all right? So we're gonna prep our catheter. If there's somebody there to assist you, if it's a rapid emergency, you do the best you can. All right, so then we're gonna flush and clamp. And do the same for the other one. For the brown lumen, you're gonna keep that you're not gonna put the microclave on it because that's where the wire passes through when you get access to the vessel. All right, so of the 3 lumens, you're going to wanna flush and prep and cap the white and the blue one on this tray, all right? You can also just kind of flush the brown once that's accessed. All right, so the anesthesiologist, you're going to just grab a syringe. This one already comes assembled, it's cannulated, okay? Depending on, they may not even care. So they access the vessel. They're gonna look for a return by pulling back, right? If they have good return and they're not fighting it, you're gonna be ready with the wire. And I always like to kind of have the little guide loose, the cheater. We're gonna undo this. You're gonna have some return. Hopefully it's not spraying. Otherwise, what's that?
Artery.
Artery, that's bad. Okay, and they'll have to start over again, put pressure and start over again. So that's in. They're gonna wire it, right? They're not fighting it. They're gonna take the needle out, keeping the wire in. Not that long though. All right. They're gonna ultrasound and they're gonna ask you to take a picture because they have to, whatever, for billing or whatever, they have to confirm placement. All right, in an emergency, that may be the second thing that they do. All right, they're going to dilate. In order to pass the catheter, they have to dilate up. There's only one size dilator. You can help assist guide the dilator onto the wire. All right. And it's not a very big, it's like a quick little, they don't pass this whole thing down to dilate. It's just a quick little puncture or widening, take it out, and then they're going to pass the catheter.
Do they usually cut the skin or?
They may. Some of them want it preloaded. I know some of the cardiac guys, the majority want it preloaded, but they will, there is a knife in here. Cut it, and then push it on, push it through, okay? And this should pass through, oh, I took the cap on. So the wire's in, they've dilated, then they'll load the catheter on, so they'll preload it before they cut, versus cutting it and then fighting with the wire.
Oh. They just cut the
They just cut the
skin a
skin,
little bit so
yeah.
that it doesn't.
So it goes, yeah, so it passes easier. All right, I've taken off my cap. This is in, they pass it through. They get it to where it's not tickling anything, right? You're watching the monitor, you're looking for any arrhythmias. They're happy with the placement. They're gonna pull the wire out. At this point, you're going to have your syringe and your other, what did I do with that syringe?
It's under the drape.
What is next to?
Under your
It's
gauze.
between your drape and your.
Thank you. All right. So the wire comes out. You have return. You can pull back. You're gonna get some blood. Tap out any air, flush, and lock. All right. Now, so then they're gonna secure it. So there's a couple of different items here. They want to do it because this, depending on where it's placed, they can adjust how deep they're gonna advance it. So they're gonna do that. They're gonna put this little locking thingy on it that I have since, okay. And then you have a suture in here. All right. They're gonna secure it in. They're gonna connect whatever lines they have. You have a bio patch, blue to the sky, and a tegaderm. All right. And that gives them 3 ports to administer fluid, resuscitation, meds, whatever they want.